Medicare, what happens to prescription costs when you change plans? Thinking about switching your Medicare prescription drug plan? You might wonder how that could affect what you pay for your medications. Let's break down what really happens when you change plans and how it impacts your prescription costs. When you switch to a new Medicare Part D plan, your out-of-pocket costs can change because each plan has its own rules. The amount you pay depends on the premiums, deductibles, copayments, and coinsurance set by the new plan. If your current plan covers your medications at a certain cost, the new plan might not. Costs could go up or down depending on the coverage and how drugs are categorized in the formulary. Formulary differences are important to understand. Each plan has a list of covered drugs, called a formulary. Some drugs might be in a lower tier with smaller copays, while others could be in higher tiers with larger costs. If your medication is not covered or is on a higher tier in the new plan, you could see your costs increase. Conversely, if the new plan offers better coverage for your medications, you might pay less. Starting in 2025, Medicare Part D plans include a $2,000 annual cap on out-of-pocket prescription drug costs. This means once you reach that limit, you won't pay anything more for covered drugs for the rest of the year. This cap applies across all Part D plans, so switching plans doesn't reset or change this limit. It's a safety net to help you manage high medication costs. It's also good to know that drugs not covered by Part D or those covered under Medicare Part B are not affected by the out-of-pocket cap. Changing plans mainly impacts your costs for drugs covered under the new plan's formulary. Timing is key when changing plans. You usually can do this during the annual election period from October 15 to December 7 each year, or during special enrollment periods if you qualify. The new plan's coverage and costs typically start on the first day of the next month or the new calendar year, so plan your switch accordingly to avoid surprises. Some plans offer a Medicare prescription payment plan, which allows you to pay your drug costs in monthly installments instead of all at once. If your new plan offers this, you can continue using it when you change plans, making payments easier to manage. Before switching, review the new plan's formulary carefully. Make sure your medications are covered and understand the costs associated with each drug. Compare premiums, deductibles, and copayments to estimate your total annual drug expenses. Remember the $2,000 out-of-pocket cap as a safety net, but also check if your medications might have different coverage or costs under the new plan. Be mindful of enrollment deadlines to avoid gaps in coverage or unexpected expenses. Using Medicare's plan comparison tools or talking with a licensed Medicare counselor can help you choose the best plan for your medication needs and budget. In summary, changing Medicare prescription drug plans can lead to different costs depending on the new plan's coverage and structure. The new $2,000 annual out-of-pocket limit starting in 2025, provides a consistent spending cap across all plans. Carefully compare your options during enrollment periods to find the plan that best fits your medication needs and financial situation.